every 3 days if you need to, in order to do that.
Yep, we're just the opposite. I mean, we have the
Yeah.
opposite snowbirds, but yeah, same thing. They're
Yeah.
like, can we get this done and over with, by next week? And that's not how it works. Sure, we'd
Yeah.
love to do that, but no, we
Yeah.
can't squeeze them closer together. We can
Yep.
always extend them out. If
Hmm.
you can go down to Florida, come back in a month, that's fine. We can
Yeah,
meet
that's fine. Totally fine.
your glasses. But that's always, not a problem. So for patients, naturally, like we just talked about, these patients tend to be kind of type A. For the patients who just keep wanting more and more reading, how do you counsel them? That was a question that just came through. How do you counsel them on the limits of physics, right?
Hmm.
The laws that exist about near vision and
Yeah.
compromise to the distance. How do you have that conversation?
So I'll kind of answer this one, Foz, because like doing your
Yeah.
own adjustments as the ophthalmologist, I see this all the time, and I'm very lucky to do all my adjustments because I'm setting the expectation to them every time we do an adjustment, not just at the consult before surgery. So, everybody thinks that this lens is adjustable, right? We could do anything with it. There's
Mhm.
no limits to adjustability. There are limits to this lens, just like any other multifocal lens we use, monofocal, any toric lens we use. There are limits to this to this technology. Okay, when I go in there and I see a patient who's 20/20 and they're J1 and they're reading their cell phone when I walk in the room, okay, and they want more reading, but if I give them more reading, I'm going to drop their distance vision quite a bit. I tell them, hey, look, if you're my mom, you're my dad, you just read your cell phone for the last hour in the waiting room, we're done. Like there are limits to this. I'm pretty brutally honest with the patient, just kind of like how I am here. It's like,
Mhm.
hey man, you're doing great. You're seeing everything I want you to see. My expectation for you was J2, J1 reading vision. Okay. And you're doing that. We're done. If I push you any further, I could fall off a cliff. I can make it worse. So I just kind of give them that fear component to them a little bit, and say, like, if they're like, oh, I used to be, I'm reading out here and I want to be up here, it's like, no, no, up here is not normal. This is normal. You were a -6 before surgery. Now you're like a -125. Okay. So they got to use that hand placement a little bit too. So I kind of just be really realistic with them and like say, hey, there's limits to this. And if I continue to do this, I can do that. But you're leading me down a position. I've done so many of these. I see when there's a problem, it's because we go too far. Okay. And I think that's not reinstated enough at the consult before surgery, that there are limits to this technology, and J2, J1 phone reading is the limit you should be expressing to this patient. Now, if you're a book reader, 8 hours, 10 hours a day, you're going to like a little magnification, a little bit of cheaters. I would like that if I'm studying for a test or I'm reading, a good book, Game of Thrones, for 10 hours a day. Okay. So I say, hey, this is for distance, computer, and this is for phone vision. That's the expectation we set.
How do you do it, Eric? How's that conversation go
Well,
for
I
you?
mean, I think this brings up two really important things. Number one, Brian hits it on the head. He is a master communicator. I mean, I'm not trying to give this guy a big head, but he is. And Dr. Newsom is too. I'm blessed to work with these guys because they're just good communicators. And setting expectations is important when you're selling anything, whether it's LASIK, ICL, RX site, it really doesn't matter. You have to set expectations, and they do a great job at it. Like Brian is like, he'll give them real life examples like cell phones and all that, and he'll show them in the room, and then he's reinforcing it. So it's like, it's really easy. When I'm doing most of the work, that's got to be me. That's got to be me. So you've got to sit there and really talk to your patient a lot and reinforce because they're always bargaining with you. You got that type A person, you got that CEO, you got that A-list actor, and he's pushing you, he's pushing you, he's pushing you, or she is. So in those patients, you're gonna have them. Nick, I know you've had them.
Oh yeah. No, all my
You
patients are
got
happy and they're totally
you
reasonable.
got to, yeah, of course. You got to
Yeah,
stop.
come to Wisconsin.
Say, okay, guess what we're doing? We're going to put a contact lens on your eye today. Dr. Szabo may not do that, but I will. I'm the OD, and like, here we go, and we simulate that crap, and that's very important. And then when they either buy it or they don't, and that's usually when you push that disparity over. And sometimes I'll put a strong one on there because I know they should be done. And I'm like, oh, here's a +1. You really probably a +15. You might like it, and give me this. Here's a +1, and they're like, no, this sucks. I don't like this disparity. Every once in a while, you'll get one that buys it, and then your confidence is going to go up to maybe push for a higher disparity. I mean, all in all, I think our enhancement rate, I mean, Brian, you can sound off on this. for the amount that we do is crazy low because we do a good job counseling, talking to patients, setting expectations, moving in one direction, demonstrating trial lenses and contact lenses. I mean, that's kind of the process. And you got to stick to it, guys. You know, that is very important that you and your surgeon are like this. Like me and Brian talk more to each other than we talk to our own wives. I mean, they get like pissed at us
Yeah.
because we're talking like every day. But it's important. You know, we love it. We dig into it. You know, we're always talking and I'm lucky. I know that's not always possible for everyone here in this call, but do it as much as you can. You know, if you're the more you're communicating, the better results you're gonna have.
Yeah, man. I think brutal honesty is really important. And it
Yes.
I think the people who have success with this, because Brian, the way you put it is totally how I do it. We talk about what the limit is, and the limit is there are laws of physics. I've said that a million times. There's laws of physics that I'm not in control of. I didn't write them. I didn't come up with them, but they exist. I would love to get you the best of the distance and the reading and no compromise. I would love to make that happen, but I can't. We don't have that option. So what we're going to do is a little bit of finessing in some art to try to cut the corners a little bit. So especially after our first adjustment, I give my patients three direct pieces of homework. Number one, I don't want them to use their reading glasses because typically we're going to start a blend. And we usually do it depending on an LAL plus or an LAL, it's going to be between -50 and -75 with a non-dominant eye.
Yep.
I tell them, don't use reading glasses. You might need them, and that's okay to pick them up if you absolutely need them, but really resist the urge to pick them up because the quicker you pick up your reading glasses, you're going to realize that things are magnified, right? And the brain just likes a magnified image. And you're going to get used to that, and you're going to delay that neural adaptation process, which can take up to a few months. And so we want to get that process started. Number two, don't compare the two eyes. Don't do this. I hate it when they do this. We call it the refractive salute. I'll walk into a room and
Yeah.
patients doing
A
this.
salute. I
Yeah.
hate
Why are you
that.
doing that?
What they're doing,
Don't do
yeah, they're closing. Like, do you ever do
Yeah.
that before surgery, Nick? Why are we doing that now?
Why are we doing that? It's like
Yeah.
asking me to throw a baseball with my left hand. It's going to look awful, right? I'm a righty, but
Yep.
I don't notice that my hands are different unless I isolate them. So don't isolate your two eyes because we are intentionally making them different and we're trying to trick your brain. Don't tell your brain we're trying to trick it. And then number three, use teardrops. We always want our patients on a
Yeah.
good brand of preservative-free tears routinely because remember that UV light is intense.